to...
Hi, my name is Sarah Haig, and I'm a physical therapist at Entropy Physiotherapy and Wellness here in Chicago, Illinois. Today I would like to talk a little bit about pain, our current understanding of pain, and why people come to physical therapy for pain. So people tend to come to physical therapy because they're either hurting or there are now things that they used to be able to do that are now a challenge for various reasons. And sometimes that reason is also pain. So in the last 15 years, we have learned a lot about pain and what it is and what it's trying to do for us. Pain is an experience that we have. So each one of us, we're going to experience things differently. So some people like to run marathons. I think that sounds painful. So it's important that if you have pain, that you can try to find a place where you can start to understand what that pain is trying to tell you. Pain is essentially a motivation to change. So it is unpleasant, and it is unpleasant in order to get you to change what you're doing. What you decide is unpleasant and what's pleasurable in your brain is part of what makes you you. And so the best clinical model we can follow for that to help you have less pain is really a biopsychosocial model. And the bio includes the body. We have a lot of bits and pieces and things can go wrong with them, and it is important to look at those and address them. But how you feel about your pain, how you feel about other things in your life, all of those are things that will impact how you interpret the signals that you're getting from your body. Sometimes those signals result in pain. The interesting thing with pain is that because it is essentially an output of our brain, it does live in your head. So if you've been to the doctor and you've had x-rays and MRIs and EMGs and multiple other tests trying to find out what's wrong with you, and thankfully all of those tests come back negative, then sometimes people are told it's just in their head. And it is true, just not in the way people think. So if you're having pain and it's so far unexplainable, or if you're having pain and it's lasting longer than it normally should in order for tissues to heal, it's really important to get a good understanding of what pain is and how your pain is happening. So as a result of a better understanding of pain, you can learn how to interpret these signals we're getting differently. Not that you don't need your knee. If your knee hurts, it's good to have your knee looked at and make sure it's working as the best as it can. If your knee sometimes hurts and sometimes doesn't, it's important to understand why. And if you don't even have a knee anymore and it still hurts, that's where understanding the pain and why it still hurts is so, so important. So there are lots of wonderful things out there in the world that can help you understand pain better. One is a beautiful book written by David Butler and Professor Lorimer Moseley out of Australia. It's a wonderful explanation, scientifically, with beautiful pictures about why you're having pain, or exactly what pain is. If you want a lighter read and a good giggle, I would recommend Painful Yarns. It is written by Professor Moseley, but it has a lot of good stories in it that help you better understand the different things that are happening in the process or the experience of pain. With this video, we're also going to post several links to wonderful blogs, as well as some other YouTube videos that can help you better understand your pain. And if you are having pain and you would like to no longer have that pain, it's really important to start the journey of understanding and to get some help from people who can help